How much is health insurance generally? Health insurance is cheaper than any compromise with your health. The cost of health insurance is not fixed. The actual cost of health insurance generally depends on your age, annual income, type of policy, either individual or family floater, it covers parents and their 2 children, sum assured, etc. Why you must have your own health insurance. Buying the best coverage health insurance plan for you and your family is the first step in your financial planning. It provides you urgent financial support during a healthcare emergency. Most people, however, do not give much thought to this. They think that their employer company has already provided them with sufficient coverage in their group health insurance plan. They think, why invest their hard-earned money on paying premiums for other health insurance plans when they can invest that money for a better return in the future? But this is not a wise decision. Financial experts say people must have their own health insurance with good coverage of medical facilities. Medical health insurance is not as costly as compared to the offered service. I have analyzed the costs of different types of health insurance policies for different age groups, and here is what I would suggest. 1. Regular health plans from general insurer, 20 lakh sum assured for non-smokers with no pre-existing diseases. 2. Combination of regular health policies and top-ups premiums for a cover for non-smokers with no pre-existing diseases. Base cover is 5 lakh rupees and top-up cover is 15 lakh rupees. 3. Critical illness policies, 20 lakh sum assured for non-smokers with no pre-existing diseases. 4. Cancer policies offered by life insurers, 20 lakh sum assured for non-smokers with no pre-existing diseases. Analyzing all facts, it is always recommended to buy a policy by comparing the maximum benefits from the same premium amount. And along with, you should always choose a reputed health insurance company to get maximum coverage, best healthcare facilities, and guaranteed claim benefits. Depends on where you are and what health programs are available. In Canada, for example, all residents of the country legal automatically have full medical coverage for most medical expenses. In the United States, depending on where you are, full health coverage, if available, can run from $100 per month to $2,400 per month. Or you might be eligible for Obamacare, and it's free. Some nations provide full or limited health care for residents. Others depend upon you paying for health insurance coverage, at whatever rate prevails in your area. Rates vary quite a bit, even in the United States. A lot depends on exactly what is covered and what isn't. For example, most plans cover you for normal expenses, like doctor's visits or a stay in the hospital up to several days, but do not cover you for things like abortions, or intensive care or elective procedures like plastic surgery. Some plans exempt pre-existing conditions, meaning that if you were diagnosed with cancer before the plan takes effect, then cancer-related medical expenses are not covered. Some coverages simply ban expensive procedures like quadruple or quintuple bypasses for the heart, which typically cost $500,000 or more. The complexity of the American system is such that the answer is hard to say, at best, because it's entirely dependent on a number of big variables. 1. If you get insurance through an employer, you have limited choices, and the average cost of PPO coverage for an American family of 4 through an employer is now about $28,000, both employer and employer portion, but this is also an employer sleight of hand, because they fund their portion, in part, through reduced wages. 2. If you buy coverage through the health insurance marketplace, it depends on the metal plan you choose to buy, and that determines both the amount of coverage, and the patient portion for any medical expenses. There are 4 metal tiers: bronze, silver, gold, and platinum. 3. Also, if you buy on the health insurance marketplace, your personal family income will determine the amount of the federal subsidy, and that can have a dramatic effect on cost. 4. Cost of coverage is also tied very closely to individual states, and even more granularly to individual counties, and the national variation is dramatic. Obviously, the cost of coverage in New York or San Francisco is going to be much higher than, say, Casper, Wyoming or Fargo, North Dakota.